practice, so we try to put both together. Yes?
Okay, I can take over. So the main point, the atmosphere of this workshop is we're going to teach you heavy concepts, but only with body exercises. Not too much theory. The fine point, I can skip, yeah, the fine point, oh, you can't see anything. Okay, it doesn't work, it doesn't matter. Let's not lose time with that. The fine point I want to illustrate today is that the connection from muscles to brain are not similar to those that go from brain to muscle. That is, the procedures through which you, a massage of the muscles can relax your mind are very different from those that you will use using your mind to relax the same muscles. And that's the only fine point I want to make today, because I think theoretically it has a lot of implications which we can discuss on at the end of the presentation. And the plan we've put together with Rubens is I first do it with very basic, simple relaxation exercises, and I'm sure for most of you it's just a reminder, because they're so famous exercises that they're nearly cliches. One will be how to influence the mind and body, and the other one will be on how to influence the muscles by the mind. And this is internal work. And then Rubens will take over, because this is relaxation, it's not only psychotherapy, but I'm going to do that first part. And then Rubens will put all that in a dialogue between the therapist and the patient, two persons, enliven it as we do in body psychotherapy. And that's all we're going to do. Very 1 hour. So the best is that what you learn when you come out of here is really remember that you probably have your own ways of exploring this difference, this asymmetrical relation between mind and body. So, I have pictures, but I don't have them, so what I'm going to use from muscle to mind as an exercise is a very well-known technique called progressive relaxation by Edmund Jacobson. And then to go from mind to muscles, I will use an equally well-known technique called autogeneous training from Schultz. Autogeneous training from Schultz.
Can I ask you something? Are you planning for the Congress, or is it your personal? No.
Before we go into relaxation, I just wait that everybody enters.
Okay, because I don't feel comfortable to.
It's not possible.
I think we're going to have to decide to close the thing, because we can't do experiential work with talking. And I'm closing it now. So, what I propose is that I guide you, and normally you do that closed eyes. You try and make yourself comfortable, as I said, in this uncomfortable environment. But learning how to relax in uncomfortable environment is a crucial part of the exercise. And learning to make comfortable in an uncomfortable place is also a crucial exercise. And the exercise is very simple. Oh yes. I need a stopwatch. In Jacobson, you take a part of the body where you have attention. You keep it tense. For example, I make this tension. You keep it for 3 minutes. In real Jacobson technique, because that's not done anymore, but it makes a whole difference clinically. If Jacobson's technique was used by Ole Osto in Reichenreich and was the main tool to analyze character structure in the 1930s. And for that, you need to keep the tension 3 minutes. See that it's normal that you tense it up here, and it's not normal that you tense up here or here and remove that tension. And after, for 3 minutes, just drop the thing and see what happens. And then we do another part of the body. For today, I will use a 1-minute technique because I'm not demonstrating Jacobson's technique. I'm just trying to demonstrate a certain point of view, which is how do you feel your mind relax if you use muscular mobilization. And I propose each of you chooses a part of his body that is tense right now. It can be any part of the body. And you tense it for 1 minute. And in 1 minute, I'll tell you, relax that part of the body. And we'll do 4 other parts of the body. Okay? So there you go. You just tense a part of the body as much as possible, but without being masochist. Just a bit less than the maximum. And now for 1 minute, you relax that part of the body and just feel what happens once you've let the elastic go. So this is meant to be an exercise where you can really know how to spot one single muscle contracted, feel what is a contraction in that muscle, and then feel how it is if it's not contracted. Or eventually, for some of you, you may feel what we call residual tensions in this case. That is, it doesn't completely relax in that part of the body. This also lasts 1 minute. And now you do the opposite tension. Whatever part of the body you mobilized, what is the opposite tension for a whole minute? You did one contraction, now you do the opposite movement and you keep it contracted. Tense, you keep it tense. So for example, if you did like this, now you do like this. Then you go like this. Now you're the church's that gets the bishop. And you relax that part of the body. And you listen to whatever happens anywhere in your organism. Gradually, you look for another tense part of your body. you increase the tension of whatever tension you spotted, and you keep that tension for 1 minute. It can be your eyes, your feet, your back, anything, your pelvis. And then you relax that part of the body. So I see that you're all psychotherapists and not a good relaxation patient. Because when I say relax a part of the body, you relax the whole organism. If we were doing strict checkups and relaxation, you would be just asked to tense one part of the body and relax just that part of the body and feel the difference. But we're not doing real checkups since it doesn't matter. But I notice you all have spontaneous body psychotherapy reflexes. Now you do the opposite tensing. Whatever was the one you used, what's the exact opposite tension that you can increase? Sometimes you need to use another part of the body too, like for example, if you want to really increase the tension here, you can go like this. This is the whole muscle here. And then you relax that part of the body. And this is for today my example of muscle work that can sometimes relax the mind. It doesn't always work. Sometimes it can provoke emotions too. And now we go to the opposite strategy, which is using the mind to try and relax the body. And normally that also relaxes the mind because it's an autohypnotic technique. So you can start by trying to, I'll give you a few more information as you're trying to do it, is to repeat in your head, not at all aloud, in yourself, my feet are heavy, my feet are heavy, my feet are heavy. And the delicate part is you don't try to make your feet heavy. You may say that sentence, my feet are heavy, and feel that your head becomes lighter or that your hands become warm. You must leave that completely open on what part of the body this sentence has an impact. But just like in meditation, you keep saying only one sentence. My feet are heavy, my feet are heavy, my feet are heavy. And you go on for 1 minute. I'll tell you where to change. And now, very directly, you say the next sentence, which is, my pelvis is heavy, my pelvis is heavy, my pelvis is heavy, my pelvis is heavy. And you just repeat that as often as you can, with keeping a very slow space. And observing everything that this sentence creates within your organismic space. The two parts of the body, but if for personal reasons you need to use other ones, then the one I suggest you just follow your needs. I suggest now you just say, my arms are heavy, my arms are heavy, my arms are heavy, my arms are heavy. And as a last part, I suggest you just say, my body is heavy, my body is heavy, my body is heavy, my body is heavy. Finishing here with the exercise, but I remind you that with relaxation, you will need 1 or 2 minutes to come back to reality in this room and for normal social interaction. So please come out of your state slowly, with small movements in the beginning, increase a bit your breathing. Don't open your eyes too fast. Each of you can have his own rhythm. So that was, I hope you realized better than with a picture or with a discourse, what I mean when I say contacting the mind through your muscles or contacting your muscles through your mind is experientially extremely different. And anatomically, actually, the procedures that are involved are very different also. And now I let Rubens continue the presentation.
Maybe some of you would like to just say 2 words about what you felt during this experience. 1 or 2 people, just to... What came up from the experience?
Very heavy feet.
Sorry?
Very heavy feet.
Heavy feet.
Very heavy feet. Left.
When I was tensing my body, my mind was thinking, am I tensing the right muscle? Am I tensing another muscle? So I was thinking which muscle I was tensing, so my relaxing wasn't as much. That's when my mind actually was.
Controlling.
For me, it's clearer mind and eyes. I mean, I have the feeling that my head is lighter, but I see better.
More inner space and more integrated.
The child became more comfortable.
What chair?
I have only feet. Very grounded guy. So I think that this demonstration is important, and I think it's also connected to Ulfrid's presentation yesterday somehow.
Yes.
And when we talk about, I used to talk about different doors of entrance. We use body psychotherapy, we can have different doors of entrance in the unconscious, right? And I think Michael proposed two doors of entrance. One to the mind, which we call somehow ectodermic door, like connected to the senses, to images, thoughts, etc. And the other door was the muscle door. Through the muscles, you might be able to bring out some of the unconscious are coming from. The other door that I think it was missing, not missing, but you didn't present it, but he said was maybe you stir up some emotions from you. You said that, right? Emotions. You used this word, but yes. Okay. Maybe you stir up some emotions. So when you bring up the emotions, we are connecting to another door of entrance to the unconscious. So the experience Michael proposed was very clear in the sense of the experience of the individual, right? So the therapist proposes you to do an experience, and you have your experience, and then we talk about this experience, right? But sometimes in body work, the therapist has more active participation in a session. What do I mean by active participation? The therapist maybe use his own body, his own senses, his own emotions, to develop the work in the session, right? So my idea here is to come out from exactly from these experiences he proposed, to another experience that we use the same terms, So maybe so I can demonstrate and use him now. So let me do the same thing we did with the other one. I asked Michael to tense his arm, as he asked you, right? So you tense your arm. And if I participate a little bit more, I could, for example, just make a little contact. Just make a little contact. And feel a bit of his tension in my hands, in my body. But not only here. I can feel his presence through my eyes, through this contact, through my muscles, and maybe I can get some of the emotions, some of the affection that are flowing between us. And then, by feeling the intensity of this contact, I can, for example, ask Michael, as he's asking you, to intensify the tension he's doing in his arm. So, Michael, please intensify it. It's always difficult when you deal with an intelligent person. Okay, so, do it again. Again. Intensify again. I'm Let's try to help. And now, we can start to feel some kind of expression coming out from this contact. You know? 30%. Yeah. So from here on, I would say, for example, that Michael is ready, you know, to have a confrontation with me somehow. If you, I don't know if you are looking at him from there, but he's looking at me like that, like defying, challenging this contact with me. So Michael likes challenges, as you know, right? What do you want?
Fine. Tense here.
That's that.
Grounding a lot because I don't want to go into emotions.
So good. So here we have two kinds of ground. One ground here and one ground there. So we have two kinds of ground, and there is another ground too, that his eyes, he cannot move his eyes from me. So now, before he was worried about you, come here, come there, but now he's very much in contact with me. So there are three grounds, we can say three grounds here. And he's intensifying more and more his hands against me. You know? So three grounds: eye contact, you know? Arm and the fingers contact, and the feet on the floor. Does it give you a good feeling that this kind of contact like this?
It's raising a bit of my aggression.
Raising your
Yeah, it's not very comfortable here.
If I let you go more, just imagine where you could go. You don't have to move more than that here. Just let come a little movement.
Nothing kind.
Nothing?
Nothing kind.
Yes, I will do that. Will you do that nothing kind?
Nothing kind.
Nothing kind to you.
No, to you, yeah.
Nothing kind to you. Why you provoke you?
Because I'm being provoked.
Sorry?
I'm being provoked.
Yes, you're being provoked.
Yes.
That's good. So it's to see how from the what he calls devices, no, and the contact with the therapist, no, we can come and develop and come to some meaning for the situation. No? Which kind of meaning came from that? If we go further on that, the meanings, you know, like confrontation, not in kind, I'm being provoked, all these kinds, maybe they have a meaning for Michael, important meaning, more important meaning, not to be provoked, if you are strongly against, right? So it has to do with you. So when we work with the patient and we try to develop this kind of contact, we will develop more intense movement coming out from the other. So, and then the meaning will come from that, which is a different experience than individual going through what you did before, and from contact, more active with the therapist. Is it clear?
Maybe I can add something? What I felt is, he forced me in a way, I accepted it willingly, but he forced me in a way to create certain tensions. Actually, there was a very disagreeable tension here. And going into that tension awakened emotions that were not there before. And then I had to manage because I am presenting something. And I don't want to give him the precedent of being able to present me as making a major emotional discharge in front of everyone. So, but it's true that this muscle excitation here and my need to ground myself, to defend myself from the emotion, makes my emotion go somewhere I would not have gone into if Rubens did not propose that exercise to me.
And I thank you for sharing, because what he said that he was feeling some pain already here. It was because we couldn't go further, because the pain will be transformed in movement and gesture, and then we will understand more and more through not the relaxation, but the expression of what's coming out from the contraction that he was feeling in his arm. Then we could go deeper and deeper in the process.
I really understand the theory, and I agree that you can do that. It seems to me that the demonstration at a crucial point did something else than what you're talking about. What Michael said when you said tense a muscle was you made this movement.
Yeah.
The resistance you gave him was that, which is a whole different set of muscular response. So you, in a way, he started a certain movement, and you gave him an impulse from the outside that radically changed the type of movement and contraction that he was making. So from then on, what you were getting was a dialogue based on your intervention, not on his original contraction.
From his original contraction?
From your interpretation of where his original contraction could go. If you take this movement and you continue it, it goes to here. That's the actual motor movement.
Could be.
Yeah?
It could be. It could be that.
Yeah.
But the idea is not exactly what you're saying now, Marianne. The idea, Marianne, right? The idea was not exactly that. The idea was as giving him some resistance, just some resistance to the impulse that was coming from him, increase the movement that was coming from him. It was not that I created the movement. I was just there to help him to increase his own movement.
I understand the principle, and from a point of view of anatomical movement, that was not what you were doing.
I think that she's suggesting that maybe would have, what she means, I think this resistance would have to have been here.
Yeah.
Exactly, against this
It
movement.
could be this movement too.
Not here.
No, it could be because when he changed it, when he did that, of course I could follow what he did in the first moment, but I was, as is a demonstration, I was not so sure that what he was trying to do in playing with me with that. Maybe he was just playing. So I asked him to do something.
I wasn't.
You wasn't. Yeah, so if he was not, was not playing, you are correct. So maybe I should follow exactly the opposite direction. In this sense, you are correct. I didn't understand. But if that was, the original movement, which I thought he was playing with me because we didn't
rehearse before.
Yeah.
No, we didn't rehearse, and we didn't. So, and he plays a lot with me, so I didn't know. That's why I thought it's difficult to deal with an intelligent guy because I asked him, he does the opposite.
And I think it's a great example anyway, because I think that it happens a lot.
It happens.
It's
It can
Yes.
happen. It can happen.
Yeah,
Exactly.
that we think that we know where this movement is
No,
going.
no, you were correct. You were correct. Now I understood what you were talking about. If I followed it, and if that was the original movement of Michael, I would follow that as well.
Yes.
Okay.
Thank
Can
you.
I add?
But the idea is the same.
The idea is the same.
Yeah, I found the example very interesting. Also, if, of course, I can compare inner data to outer data. So I would agree with Marion fully, by the way. But the interesting point, because this is where we go exactly, I've talked to you, is the Minsky's quote about the danger of putting sticky fingers in connective systems. And there we have a very beautiful example, because we can see how the countertransference of Rubens, nourished by a long relation of friendship between us, where he thought that is he playing with me or not, made him do a certain resistance. If you read in a real clinical situation, it's a bit artificial here, he may have done another resistance. But at the same time, you see how quickly it's possible to make a mistake, or to impose on the patient, with such techniques, emotions that he wasn't needing to live at that moment. And the switch is, that's what I didn't have time to say yesterday, because a lot of my texts, regrettably, I didn't say because I tried not to read it, but anyway. But as soon as we touch it, organismic connectors, energy can just escape you extremely quickly. And I think the dangers of the 70s, which most of us have lived, some of us at least have lived, the older ones in this room, where, as I said, we mustn't stop doing it. We must learn how to do it in a much more refined way. And I think your very refined example, because it's very precise, allows one, and the problems we have between us two, the revising that exercise in such circumstances, allows us to really pinpoint the places of the technicalities of such work in a very beautiful way. So I thank you for that.
No, it was interesting. It's good that you remind, because when he did this, I tried to give some, but he decided the opposite. So Michael is known as the anti-man,
But that's your counter-transference.
I think that's pretty good.
Well, I just wonder if this very disagreeable sense that you had in your biceps during the confrontation comes from not being met in the flexion movement. Would you give some comment on that?
I really don't know.
No.
I just noticed
Yeah.
that this wasn't there before,
Yeah.
and that suddenly it was there. And as long as I had to do that exercise for demonstration purposes, I was stuck with that. That's all I know. There's no closer theory to that.
You can't make sense of it
No.
anyway, as it's
Well, we'd have to work on it. I mean, but that becomes private.
of course.
Yeah.
But that is also my question. You say that wasn't there before. So wasn't it there before, or didn't you realize that it was there?
Yeah, well, you're quite right. It wasn't there in me. I mean, I wasn't aware of it. I was not in contact with something like that. But of course, you never know if it was in unconscious. This is an infinite discussion. That's why in therapy, I always say that you mustn't do interpretation.
Yeah.
You must, if you have that hypothesis, which is a plausible one, then how do you check it?
Yeah.
Because while interpretation is always possible, it can be inspiring. And you might be right. But then, if we were in psychotherapy, which is not the case, how do you check to verify if your first interpretation is only countertransference, or is it really something where you felt, or it can be a mixture of both?
But I want to understand, why we always have to go with the movement? Maybe there are cases where, what happened here was very valuable for the client and will create different good outcomes. So I don't think there is wrong or right about it. And maybe we will spread something. But maybe do this.
We don't have to always do the same thing, because just adding something else to what he was proposing. So the flexibility of the therapist is very important. So that flexibility is to try to get into the original potence you have inside the person. Try to find the original power that is in there for the movement. That's something that will bring meaning for the person.
So do you think if you do the opposite thing, if you not, I'm thinking about your exercise of, going from the mind to the body and going from, maybe it works the same way.
Well, that's where I was exactly where I was going to come to, so I can take your sentence and go on, which is that our idea for choosing an exercise at that time, I didn't know which one you would really choose. That was open in our discussion, although we tried that one a bit before. Was that, of course, that model that I asked you to experience within yourself, in body psychotherapy, we have it both ways in the two people. And this is why, as a psychotherapist, I don't know what I'm really doing if I propose an exercise. I'm just exploring something in contact with the patient. But I have myself the fact that what I get from my arm that reaches my mind is only a part of the information that has reached my brain to start with. And then what I do with my mind to try and make to say, oh, you should do this with your hand. My hand may do something, in fact, which doesn't quite correspond with what I thought. And when we're doing body psychotherapy, you really have to put in your everyday model, because we're talking of everyday experiences, sometimes every minute experience, that this complexity exists. And it's not only transference and countertransference, this is a simplification in a way. There's many more other variables that enter in such a dialogue, which I think you use the word resonance to summarize it in one word.
Can I ask a question? Because your movement was not going with it, is there a possibility that that was bringing other emotions as well? Like you said, it was bringing emotions that were there. Did you understand my question?
I think it could be, but the demonstration between both of us, it is kind of special demonstration. As he said, as we are friends and there are lots of things between us, Of course, there is also a play. Of course.
Yeah, but let's put it, okay, let's imagine we're not here, and let's imagine it happened, you go that way, the client is going the other way, and you keep going that way. And I'm putting myself there, and I'm going, I'm pushing this way, and you keep pushing me there, and I could see my head going like, come on, push me this way, come on, and how bad.
Sometimes it's very difficult to find the original movement, as she said. But sometimes it's difficult to try many ways, and then it might come out one day.
No, if you don't want to interrupt you, were you finished?
Yes.
Oh yeah, okay. What I could see happening, the more it got unpleasant here, his neck got more and more stiff.
Yeah.
Is that what was I right in my observation? So I thought you didn't draw on this. You saw it probably too, but you didn't say anything about it because because we not only watch or with one part of the body, but we watch the whole of what's happening in a certain way. So also like strong reactions in other parts of the body, strong mobilization.
I try to pick up small things, not go further.
Yes.
Even if he was doing the opposite movement that in fact he wanted to do,
Yeah.
I follow what he was doing, just
Yes.
so that we can have a sense of the experience.
Okay.
Maybe, even if it was wrong, I was not so much worried that to get into Michael's original, but just to have a sense that from the tension, you can develop a movement that can bring sense, can bring meaning to the person.
I agree.
And that's what I wanted to show.
Yeah,
you know?
yeah.
And
Yes.
of course, this is not a session, it was just just a demonstration of the movement.
Yeah.
If I can add something to what you said is, if you remember my lever model yesterday.
Yes.
So for me, this was a lever actually on both of us.
Yeah.
That is my hand, and this for body psychotherapists is very important to realize. My hand was a lever he used to have a lever on me. Let's put it this way.
Yeah.
And of course, as we're not, no one who knows in advance everything you will do, because I don't suppose many of us will still work like that. What you do is you use the lever, you check what happens.
I know this much.
I know, but I'm saying it for the whole room. And so I think that's what was happening.
Yes.
Yeah. And this can happen in body contact, but it can happen to the eyes. Eye contact too. Eye contact can be very much confrontative. It can stir up lots of things just through eye contact. Not only eye contact, but just little movement from far away can provoke. You don't have really to touch the person. When you touch, of course, you have a quite quick response. A quite quick response for it. And so both responses of Michael, one was to face me, the other one was to contract to himself. So he had two movements, in fact, because he was there with me, even if he wanted to do that. Afterwards, he was there with me, and maybe there was both of them. One to come, one to confront, and one to.
We have time for one last question. The lady there.
I don't know the time.
Yes, here.
Looking at the whole thing, I'm curious about, what came first, because it seems that there also could be a possibility that your question and you being invited in, you had a response to being invited in.
Yeah.
So, in your action then, your action, as I would have seen it, and I'm purely saying my interpretation of it, was quite defensive when you actually came out like this. So it seems that the actual thing was put in play prior to even contact. So I'm curious about that.
So, but to start with, it's possible, but I'm interested. You have a theory about what I did. She has a theory about what I did. If we asked everybody, we would have 20 theories about what I did. And so it's important that we realize that our spontaneous interpretation is nevertheless an interpretation. And then comes the question, let's say it's even a hypothesis, how do I check it clinically?
Yes.
But I'm not saying you're wrong, it's just, if we were in front of a real case, how do we check it?
And how do you check the actual origins of when it's set in place?
Yeah, well,
because I think that's part and parcel of it.
Checking during a session is something I do a lot. Checking, is that correct? Is that okay for you? How, it's something because you're never sure that you are in the right position. And then you check every time you have a doubt or you have a sense, so you check. Even if you don't have a doubt, you check.
And actually, even if you do it all wrong, and I'm really putting brackets around the word wrong, I've had very explosive sessions with patients where, in a way, I did do everything wrong. Okay? But as long as you let the repair systems work, then suddenly I notice where my countertransference is, and I realize that this countertransference corresponds to something we hadn't worked on yet about her past, because I went to see my supervisor and so on. So the whole thing is not whether you're right or wrong at this moment, because there's so many possibilities at every moment, so many crossroads. But how are you using all that material to really further the patient's understanding of himself is the important part for me. Well, 3 short answers because 5 minutes.
Just
I'll let you say it.
I wanted to ask Rubens how he felt, because there was all this conversation is going on about Michael. But I would like to ask Rubens how it was, because it was a complicated situation. You have colleagues, you have friends, and I wanted to have a feedback from you from this exercise.
As we are friends, in fact, I tried to intensify something I was feeling from him to him, and I focus on that. You know, I didn't. I avoided to get into maybe some play that was going on in his. You know,
He was
because, you know, when he did like that, he was laughing at me. I don't know if you saw it. He did like that and started to laugh. I pick you up. You know, you saw it, right? So it was a double. So when I felt that, so in fact I asked him just to come and just to stay in one position again, so I can do the demonstration. Somehow I wanted to demonstrate something, you know. So I tried to make him help me to do the demonstration. Otherwise you will.
Also, what I was seeing, it was just a very beautiful meeting between the two of you and all of your complexities, and all the complexities of your long history together. And just watching that, and you know, and how it moved back and forth, and how you both contained yourselves and let yourselves be a little uncontained. It was just very beautiful to watch.
Well, I think the idea that we sometimes need our clients to help us is actually quite true. The idea that we sometimes need our client to help us,
Especially here.
Generally.
Next time I choose a proper client.
Perhaps there's also, the hypothesis, but also that we must not get too attached to needing to know what's really going on. Yes, being curious, exploring, having concept, whatever, but in the end, do we ever really know? You know, in the clinical setting. And that just gets in the way of letting it unfold.
Well, and how much can we let go of the therapist? Needing some help from the client. I mean, that's all part of being present.
Well, that depends how you define the therapist position. If you define it as the expert, then yes, I agree. If you define it more as the facilitator, holding the space open for something to unfold.
Okay, thank you very much.
Das ist jetzt im zweiten Stock, im zweiten Raum. Ja, im zweiten Stock. Ja.